Hey guys, welcome back to the channel McNallie Money, your home of all things stock, investment, and personal finance related. In today's video, we're going to be profiling Psyence Biomedical Ltd. This is an innovative company focused on botanical or naturally sourced psilocybin-based medicines. A lot to talk about, some recent press releases as well. Before we get into it, take a second, smash the like button, you guys. Big help to myself and the channel, specifically in getting this content to other people like you who may find value. If you're not already subscribed, McNallie Money, feel free to join and let us know in the comments section below if you've heard of Psyence Biomed before, if you're currently holding shares, and your outlook on the sector for the remainder of 2025. Now with that being said, let's get into today's video. Okay guys, so that's right. Today's video is going to be focused on Psyence Biomedical Ltd. Trades on the NASDAQ in the United States under the ticker PBM. Now this is as of Monday, April 14th, about midway through the trading session, currently up 6%, trading at 47.6 cents per share US. And if we zoom out to a 5-day view, you can see up 8.7% over the last 5 trading sessions. Now, market cap on Psyence is in the single $1 million range, and this one is definitely starting to grab some investor attention for a number of reasons we're going to lay out in today's presentation. Now, if we jump over to the corporate website, sciencebiomed.com, I'll leave this linked in the video description below. You can go in and take a closer look for yourself. A good description of what the company is all about. As I alluded to in the intro, this is the world's first life science biotechnology company, traded on the NASDAQ, again under the ticker PBM, focused on the development of Botanical, which is defined as nature-derived or non-synthetic psilocybin-based psychedelic medicines. The name Psyence combines the words of psychedelics and science to affirm Psyence Biomed's commitment to an evidence-based approach to innovation as it works to develop safe and effective nature-derived psychedelic therapeutics to treat a broad range of mental health disorders. Psyence Biomed is initially focused on mental health disorders in the context of palliative care. Now we're going to look at their offering in a second here. I did want to bring up the team itself, which is headed by Dr. Neil Marsky, who's the CEO, and prior to joining Psyence Biomed was the Vice President of Scientific Affairs at AstraZeneca Canada, with over 17 years of experience in research-based pharmaceuticals, where he held positions with some of the top players in the industry. Now Neil is surrounded by a strong group or team of industry experts with long-standing experience in their specialties or fields, which leads us into the investor presentation, talking about some of the various different programs currently being run at Psyence Biomedical. As you can see here, this is focused on their psilocybin 25 milligram development programs, currently focused on adjustment disorder, AUD or alcohol use disorder, substance use disorder, and undisclosed CNS indication. Various different stages within the development pipeline, with this deck being put together in November of last year. Now, where this gets interesting and compared to traditional drug development, when you're looking at the development of botanical drugs, you've got a differentiated FDA pathway, intellectual property advantages, including process patents for extraction, purification, and standardization. This is very difficult to genericize and more similarity to biologics than to small molecules, shorter clinical development cycle, really due to the large body of existing evidence of usage and safety that can replace usually required preclinical studies, and efficacy and consumer preference, with naturally sourced active compounds appealing to patient preferences and really becoming a common trend or theme. And this is really a great slide comparing nature-derived psilocybin to synthetically produced psilocybin. And worth noting that Psyence has licensed proprietary patent-protected methods of extraction and standardization, as we just discussed, that may preserve the benefits of nature-derived psilocybin with consistent potency ideally suited for therapeutic uses. Now you can see on the nature-derived side, benefits like containing secondary alkaloids which may contribute to therapeutic benefits, long history of safe human consumption, and proprietary extraction, standardization, ensuring consistency of dose. On the synthetic side, these are typically highly purified single molecule compounds. There's less data or emerging data around safety and tolerability, and generally standardized dosing. So it's no surprise that articles are now coming out stating that nature-derived psilocybin may be demonstrably more therapeutic than synthetic, which again supports patients, specifically in the case of Psyence Biomedical, that are receiving palliative care and worth noting that this is not considered end-of-life or hospice care, but more so is specialized medical care for people living with a life-limiting illness such as cancer or heart failure. So now that we have an understanding of what Psyence Biomedical is all about, the team behind it, and some of the history or data behind nature-derived psilocybin, I wanted to jump forward to two recent press releases that just came out in relation to Psyence Biomed signing an LOI or letter of intent with Southern Star Research to expand their Phase IIb clinical trial in Australia, so really building on that drug development pipeline we just mentioned. This new partnership strengthens Psyence Biomed's global clinical trial capabilities, accelerating the development of psilocybin-assisted therapy for adjustment disorder, which we just saw on that pipeline slide. Now, Southern Star Research is a premier Australian contract research organization known as a CRO, and the collaboration is going to accelerate Psyence Biomed's ongoing Phase IIb psilocybin clinical trial in Australia, which again is focused on adjustment disorder in patients diagnosed with cancer. Now, in terms of the market size here, adjustment disorder ranks as the 7th most frequently diagnosed psychiatric condition globally, affecting millions of people who currently have no FDA-approved pharmaceutical treatment alternatives, with Dr. Neil Marsky, the CEO of Psyence Biomed, going on to say Southern Star Research's state-of-the-art operations with its advanced infrastructure, national network within oncology and mental health, as well as an in-depth knowledge of the Australian clinical trial environment, will enhance patient recruitment and support efficient trial execution. Their expertise and dedication to clinical excellence make them a strong partner in our mission to develop innovative therapies that address the urgent mental health needs of patients with adjustment disorder. So a very positive catalyst for Psyence Biomed and a big step in the right direction in terms of their Phase IIb trials. Now, the other one that caught my attention came out on April 10th, was Psyence Biomedical Ltd redefining their psychedelic medicine with a multi-asset strategy, advancing clinical trials and scalable manufacturing. The company executives actually held a corporate webinar for investors and stakeholders on the 10th of April, noting that Psyence Biomed is now working towards becoming one of the few vertically integrated biopharma companies focused on building a multi-asset biotech psychedelics platform that we believe enhances our competitiveness and strengthens our position for future growth. With expertise in clinical research, scalable production, and global supply, we are well positioned to drive long-term value in the evolving psychedelics industry. Now, at the core of this strategy is that ongoing Phase IIb clinical trial, which we just saw in the last press release, targeting adjustment disorder in patients diagnosed with cancer, again, ranking the 7th most frequently diagnosed psychiatric condition globally with no FDA-approved pharmaceutical treatment, and then going on to talk about some of the specific life sciences tax incentives or rebates of up to 43.5% on the clinical trial costs, and the fact that Australia has already rescheduled psilocybin and MDMA 2 years ago, really positioning them at the forefront of both clinical research and real-world evidence. Now, they then go on to talk about their exclusive royalty-bearing IP license or intellectual property license agreement with Psyence UK Group, which is a federally licensed facility for cultivating and exporting psychedelic compounds, which could potentially support long-term access to the EU GMP-certified ingredients. So that's a great partnership that supports Psylab's long-term vision to become a leading supplier of naturally derived pharmaceutical-grade ingredients to support psychedelic-assisted therapies for patients around the world. They're investing in world-class scientific leadership, as we saw on that About Us slide. One of the most significant achievements is the recent recruitment of Dr. Dan Stein, a recognized leader in the field of psychopharmacology, further bolstering the team's leadership and experience, strategic growth, and clinical expansion, with the company now in the process of assembling a steering committee to launch their clinical trial in AUD or alcohol use disorder and other substance use disorder or SUD, again representing massive markets around the world, strengthening of their financial position to really maximize shareholder value, with their commitment being to building a resilient multi-asset biotech company with solid fundamentals designed to withstand market fluctuations, and then a forward-looking statement talking about the recent Forbes report highlighting a projected $3.3 billion growth of the psychedelics mushroom market by 2031, underscoring the immense potential of the industry, with Psyence Biomed being well positioned to capitalize on this opportunity. And here's a look at that webinar link that took place on the 10th of April. So for those reasons, you guys, I would definitely recommend you take a look at Psyence Biomed. I'd be curious to hear your thoughts in the comments section below on the sector as a whole and this company specifically. If you're still watching the video at this point, hopefully you found some value, so make sure you hit the like button. Feel free to subscribe to the channel, and we'll see you back here in our next video.